Hi, Paul Sakis, Good News Planet. We're speaking to Dr. Jenice Baker. Hi, doctor. How are you?
I'm doing well. How are you?
Good. You're Assistant Medical Director of the Emergency Department and Attending Physician at Our Lady of Lourdes Hospital in Camden, New Jersey. Wow, you're a hero, and thank you for doing that kind of work. And today we're going to talk about something very quite serious. And these symptoms could mean something serious, so there's no time to wait. It's a no time to wait campaign. People may think that leg swelling, pain, tenderness, or redness of skin may be minor symptoms, it says, but they could point potentially serious conditions such as deep vein thrombosis, which can lead to pulmonary embolism. So those are very serious situations. And so tell us a little bit about deep vein thrombosis, please.
They are serious conditions. Deep vein thrombosis, or DVT, is a blood clot in a deep vein, which usually occurs in the leg, in the thigh, torso, but can also be in your arm. And that can present as leg pain, swelling, redness, or tenderness. And it may be minor, but it can be the sign of a DVT. And that's important to know because a DVT can then break off and travel through the bloodstream and cause a pulmonary embolism or a blood clot, PE, in the lungs. And when you have a blood clot in the lungs, that can cause chest pain, shortness of breath, difficulty breathing, and that is very serious. In 25% of cases of patients with PE, it can end in death. So that's why it's very important to know about the symptoms of DVT and PE.
Okay. So, I've been doing this a long time, interviewing people, and I've interviewed celebrities and well-known people, San Diego Chargers, football players and baseball players. And I happen to know that people like Regis Philbin and I think Hillary Clinton had a bout, and Jimmy Stewart going way back, I guess. What is it about? Then there was something about planes, or what is it that you think is why is this occur? Basketball player, a lot of basketball players, are concerned with this. Why do you think that happens with either sedentary people on planes and things, and or crazy sports people?
Well, DVT-PE, according to the 2010 CDC data, affects as many as 900,000 Americans. And there are many different risk factors that can have someone be at risk for DVT-PE. A few of them include immobilization, so not moving around. Some of them can be trauma. Some of it may be prior surgery. Some of it may even be genetic inherited disorders. But that list that I've just mentioned is not the end all and be all. There are many more risk factors. So what's important to know are the signs and symptoms, and then for you to talk to your personal provider, your doctor, or your nurse practitioner, your personal care team, because they will know your history and be able to help risk stratify you. But if you are unaware of what the signs and symptoms are, and if you don't realize that that leg pain and tenderness you're having could be signs of a DVT, you may not seek care. And that's why I'm here to give this education and bring this awareness about DVT-PE.
Uh-huh. So I mentioned at the beginning, swelling, redness, things like that. Mm-hmm. And so a lot of people, I don't know, I don't do it that much myself. Either I feel pain, but I don't really examine my body that much. Is it important to examine your body? To look at your body and see if anything's changed?
Yes, I think that's very important, especially if it's something that you've not dealt with before and hadn't already cleared and checked with your physician with before. So if you're having this new leg discomfort or tenderness, I would examine and look, see if you notice that swelling, see if you notice that redness. But even if it's tenderness and you're not sure what's going on, to follow up with your healthcare provider Or you can even go to www.notimetowait.com, where we're able to give information about the risk factors about DVT-PE. But I think it's very important to be an advocate for your health and help with the examinations if something is not feeling right.
How does a doctor tell that? Are they able to see? Are they looking for the things we just talked about?
So the education that I'm talking about here today is for patients to have awareness. And that's why I'm here on behalf of the Bristol Myers Squibb and Pfizer Alliance as part of the No Time to Wait educational awareness campaign. So symptoms that patients have, let them make that crucial decision to go see their doctor, to have it checked out, to have it evaluated. If they're having this discomfort, but they don't realize it may be a sign of something more important, and they may not go to their physician to have that important physical examination, then it may be missed. I'm happy you were able to go and see your doctor, and your healthcare provider was able to do that examination and rule that out. But there are many people, and many people I've treated in the emergency department, who did not know that this disease existed and didn't know that they were at risk for this. And early diagnosis is always important. The earlier we can diagnose DVT, PE, we can treat it early, and the earlier we can diagnose it, some cases we may even prevent that DVT from becoming a pulmonary embolism. So this is why awareness for the public is so important.
Do they do surgery for this? Is that how they then fix the blood clot?
So there are many different There are many different treatment factors that can be done for DVT-PE, but that will really depend on the individual patient. Today, I'm here on behalf of the patient as an advocate for education and for awareness, so that one, they're aware of these signs and symptoms, that the leg pain, the redness, the swelling could be sign of something serious like DVT, that the chest pain, shortness of breath, difficulty breathing, even syncope or passing out may be signs of pulmonary embolism. And so that they don't ignore these signs and symptoms, that they're aware of this DVT-PE process. And they can go to www.notimetowait, because it really is no time to wait.
Thank you very much. You're well spoken for this concern, and we appreciate this important good news. Thank you.
Thank you for having me. Be safe.